Hello, this is Dr. Laura Pfeiffer. I'm a naturopathic doctor. Today, I wanted to talk all about the naturopathic approach to mental health, really highlighting the gut brain connection and how our gut health is really, really important when it comes to our mental health. So first, I want to start with talking about anxiety. According to Merck Manual, anxiety disorders are more common than any other class of psychiatric disorder. However, they are not recognized often and consequently not treated. Left untreated, chronic maladaptive anxiety can contribute to or interfere with treatment of some general medical disorders. So I see a lot of anxiety in my practice, and I know a lot of people do suffer commonly from anxiety. So it is important to be able to properly diagnose it so that we can treat it. Some symptoms of general anxiety, we can have both physical and mental symptoms. The physical symptoms can be anything from getting tired easy, muscle tension, restlessness or feeling on edge, having tremors, sweating, having cold hands and feet, heartburn, heart palpitations. And then the mental component of that can be problems sleeping, difficulty concentrating, difficulty controlling worrying. It can really amount to irritability. And then we're kind of worrying about a number of events that really take up our life. So, starting with looking at our nervous system and how we're really going to connect this to the gut, a lot of people think that when we're treating mental health concerns, we're only looking right directly in the brain. And so, I really want to highlight the role that the brain plays with the respect to the gut as well. So, our nervous system, we have our sympathetic versus our parasympathetic nervous system, and they basically have opposite roles. Our sympathetic is part of our fight or flight, and our parasympathetic is responsible for our rest and digest. So that helps us kind of calm down and puts us in that Zen state. More often than not, people tend to be in that sympathetic or that fight or flight state more often than in that rest or digest. So the nervous system in the gut is actually called our enteric nervous system, known as the little brain. It actually functions independently from the brain to control our GI functions. So our little brain or our enteric nervous system is responsible for our GI motility, secretion, blood flow, basically getting our bowels moving and getting our entire gastrointestinal system working. When we look at the digestive system, the human intestine harbors nearly 100 trillion bacteria, and all these are essential for health. These can help break down our foods, assist in our immune system development. Bacteria in our gut influence our mental response to stress, and stress changes the bacteria in our gut. So, really, they work both ways. So, it's not one versus the other, but it is both kind of working together. So, we do need a healthy digestive system in order to have mental health or mental wellness. Looking at the human microbiome, you've probably heard the talk about probiotics and microbiome. Basically, this is good bacteria in our body, known as our flora. This is a total of about 100,000 billion microbes. So that's a lot of microbes in our body at once. And they are located not just in the gut, located all the way from the oral cavity, all the way out to the genital urinary tract, out to the vagina, out to the urinary tract, the vaginal canal, out to the skin, the respiratory tract. So it's really located everywhere. The functions of this good bacteria or these beneficial bacteria is to number one, protect against infection, help with the function of our intestines. A lot of people, when we think of good bacteria or probiotics, we automatically think of bowel movements and having regular bowel movements, and we can probably attribute that to the Activia commercials. However, it is important to note that it does have a lot of other actions, so regulating the immune system throughout life and a variety of other benefits. When we're looking at the microbiome, so we have the microbiota in the middle, we have a brain arrow, and we have our behavior, and then we have factors that can all impact the microbiome that will then impact the brain. So the microbiome is a dynamic entity. It is always changing. Every single thing we do every single day is either helping or hurting our microbiome. And so what happens is we have several factors, including genetics, diet, metabolism, age, geography, antibiotic treatment, and stress, and all of these sorts of things can impact what our gut bacteria looks like. And by geography, I mean traveling, living elsewhere really impacts what bacteria we are exposed to. Gut bacteria has impacts on our entire nervous system. When our nervous systems work properly, we're at a lower risk of disease. And that's basically what this graphic is showing you. We have the microbiome here. We have it pointing to all of the different functions it has. So, functions in the immune system, the autonomic nervous system, which is the ANS, which is basically things that work on their own, the CNS circuitry, so our central nervous system, brain and spinal cord, the GI function, which I've already mentioned with respect to the enteric nervous system, and then we have all of these things that it's leading to. So all of these things can change our behavior, our stress reactivity can cause low-grade inflammation or heal inflammation, and will contribute to our barrier function or the barrier in our gut, which will leave us either vulnerable or protected from different microbes and infections. And then we have our fat storage and energy balance. So either this is going to be normal or we're going to be starting to increase our risk of disease depending on kind of what way we're going with things. Now, looking at our diet and diet related changes in the gut, our microbiota influence can have a huge impact on our gut brain axes. And this can actually, in turn, influence behaviors. So, this can actually contribute to something like anxiety and depression. So, the more digestive inflammation that was present in mice, the actually higher levels of anxiety they experienced. So that was a very interesting finding. And so what they did is they looked at mice, they looked at their anxiety-like behaviors, they looked at their inflammation. They found that as their inflammation went up, they found that they actually had more anxiety-like behaviors. And so I wanted to do a little bit of a self-assessment, and this is basically something you can use to quiz yourself and see where you might need a boost when it comes to your digestive health. So, really quick kind of quiz. Does your digestion need a makeover? So, first of all, ask yourself, how many bowel movements are you having a day? One, less than one, or more than one? If you answer, and then we're going to answer yes or no to the following questions. So, I'm going to get more information about your bowel movements. Are they easy to pass? So, yes or no. Do they have undigested food, blood, or mucus, or is there blood on the tissue when you wipe? Do you experience bloating? Do you experience abdominal pain? And when I'm talking about bloating and abdominal pain, I'm talking about the type that you can't attribute to anything else. So, for example, if you know that a certain food causes you bloating or pain and you eat that and you experience abdominal pain, we're not going to count that. I'm talking about the times where you're bloated frequently, I would say a couple times a week, and you're just unsure of kind of what the reason is. Abdominal pain, again, if you're experiencing that more than once a week, then we're going to say yes to that question. Do you experience nausea or vomiting on a regular basis? And this is one time a week or more. So if you answered yes to one or more of these quiz questions, or you answered that you have less than one bowel movement per day, you need a digestion makeover. And that's just an easy way to kind of start to look at things. But the Bristol stool chart is something that I use really often with my patients because I like to get an idea of what number you're at. And when it comes to digestion, we are only used to what we have created. So oftentimes we're not talking to our friends about what our poop looks like and comparing that. However, we know what our poo looks like, and if it's always been the same, then that's our normal. If we've only ever had a bowel movement every 3 days since we can remember, then that's our normal, and we think that we're regular because we're regular every 3 days. But that doesn't mean that's normal. That's just what you're used to. So I like to do a Bristol stool chart in order to get a visual of kind of where you're at. If you're around type 3 or type 4, I would say you can consider yourself quote unquote normal. But if you're anywhere at the numbers above or below, then we need to talk about your digestion. Now, looking at the gut-brain axes or the mind-gut connection, I always look into blood sugar regulation. That is not just for diabetics. Your brain, like all areas of the body, relies on a steady supply of glucose to function properly. So if you have low or high blood sugar, that can actually mimic or contribute to anxiety. So if you are suffering from anxiety, then we need to really look at, again, from a dietary perspective, from a gut health perspective, looking at what you're eating and how your blood sugar is looking throughout the day. Low blood sugar can also cause fatigue, irritability, mood swings. If that sounds familiar to you, then blood sugar regulation should be at the forefront of your gut brain treatment. And now looking at how food affects your blood sugar. So here's a graph. Basically, we're looking at different types of food. So the solid line is fat. We're looking at coconut, avocados, butter, nuts, olive oil. We look at protein, such as meat, fish, cheese, and eggs. And then we look at carbohydrates. That's our pasta, bread, rice, starchy vegetables, fruit, sugars, honey, milk, and yogurt. And so really what we're looking at is we're looking at our blood sugar levels in our hours after eating. So when we consume something like a carbohydrate that is refined, we can notice how our blood sugar spikes and comes right back down. Versus when we eat something like a fat or a protein, you can notice how your blood sugar doesn't actually have a spike. And the spike that it has is actually prolonged and goes for a number of hours after eating. So we don't have that spike. When we have those spikes throughout the day, if we're eating, we wake up and we have cereal, we have a bagel for lunch, we have toast for dinner, or we have pizza for dinner or something, we have these constant spikes. If you can imagine, every couple hours, every 2 or 3 hours, we're eating some more carbohydrates and we're having spike and we're falling, spike and we're falling, as opposed to adding in healthy fats or protein, which are actually keeping us sustained. So the first thing about gut health is mastering your diet. And so the first thing I like to do with my patients is start with breakfast, because it's easier to start by changing one meal than by trying to make a 180 with your entire diet, your entire lifestyle all at once. So I usually start with, what do you usually eat for breakfast? Cereal, toast, nothing, something else. If you're not eating, then we probably need to talk, because there is something to be said about intermittent fasting, but a lot of people don't do it right. So that's kind of a whole topic on its own. But if you're eating something like cereal, what type of cereal is it? Is it part of the refined carbohydrates that we're looking at here that are going to spike our blood sugar and bring us back down? Or is it part of the nuts and nut butter sort of mixture, and we're sustaining ourselves for a few hours? Looking at what you're snacking on. Are you snacking on granola bars, fruit, chips, candy, crackers? What type of snacks do you pull for? And if we're looking at reducing our blood sugar, we're looking for snacks like nut butters and avocado. We're looking for boiled eggs that have lots of protein. We're looking for things that will sustain us throughout the day, as opposed to things that are quick sources of fuel that are going to spike our blood sugar. And then looking at what you're eating throughout the day. Your blood sugar levels need to be stable. This means eating at consistent intervals, eating foods that make you feel full for a long time. So healthy fats, lots of protein, making sure that you're eating enough that it's going to sustain you for a long period of time. So healthy fats and protein basically keep your blood sugar stable and help keep you full. These are things like eggs, avocado, nuts and seeds, again, unflavored, unsalted, looking at hemp hearts, looking at coconut oil, lean proteins, so turkey, chicken, and then other protein sources such as beans and legumes. And then mastering your digestion. Obviously, mastering your diet is part of mastering your digestion. But when we're looking at your digestion in particular, everyone is individual. Looking at food sensitivities is often something I do with my patients, because you are what you absorb. Lots of people say you are what you eat, but if you're not absorbing anything, then you aren't what you eat. You are exactly what you absorb. So when we have food sensitivities, these can cause mental health issues. This can cause fatigue, mood swings. This can cause bloating, abdominal pain, constipation, diarrhea. And we know from my previous notes that all of those things can actually help or change our microbiome in a way that's not conducive to health. Food sensitivities can also cause acne and fatigue. So how I discover food sensitivities in my practice, usually number one would be the food sensitivity test. It's basically a blood test. And number two is doing an elimination diet, because again, we really don't know what you're reacting to until we can actually see it on paper or see symptoms through a properly done elimination diet. Probiotics, again, lots of probiotics are in the news with respect to different research coming out. There's a lot of great research coming out on probiotics, and these help our microbiome. Probiotics can influence anxiety-like and depressive-like behaviors. And again, things that can disrupt our good bacteria. Food sensitivities, which I mentioned, stress, poor diet, lack of sleep, these can all disrupt our good bacteria. And like I said, our microbiome is ever changing. So everything we do is influencing our good and bad bacteria in either a way that's positive and conducive to health, or negative and detrimental to health. So getting our probiotics in, you can do food sources. So kombucha is one of them. You want to really be aware of too much sugar. Sauerkraut is a food source. Kimchi, miso, you want to be aware of having too much salt. And then getting a good quality probiotic is always a good idea, but you really want to check with your naturopathic doctor because there are specific products that have specific strains of probiotics and different types, and those combinations can be good for specific conditions. So you don't just want to get any one. You don't want to get a poor quality one. Whenever it comes to supplements, you need to make sure that you're getting a good quality supplement because that's going to impact how it works on your body. Hydration and caffeine. So a lot of people think that caffeine helps their digestion because it helps them poop. Caffeine is actually dehydrating. So what I always tell my patients is match your water and your coffee. So if you're having a cup of coffee in the morning, have a cup of water and then start your water intake from 0 at that point. Water not only helps our digestion, so with constipation, abdominal pain, and bloating, it helps our mental health. Dehydration can cause brain fog, lack of focus or concentration, and it helps our physical health, athletic performance, and muscle tension. Exercise, again, for mental health, it is beneficial for digestion as well, which makes it beneficial for mental health. Consistent physical activity has been associated with a decrease in the rates of IBD or inflammatory bowel disease, flares, and that's also known as Crohn's or colitis, ulcerative colitis, gallbladder disease, and colon cancer. Moderate exercise has also been shown to increase the biodiversity and the prevalence of different species of bacteria, which is a really beneficial thing. Whenever we can increase the diversity of bacteria, we're doing a good thing for ourselves. But also, exercise is beneficial for bone health, hormone health, and like we talked about, blood sugar regulation. And blood sugar regulation is important for both gut health and mental health. There are other things to consider when we're talking about mental health. Again, it's not just gut. Gut is a huge part of it, but looking at blood work is something that I always do. Looking at iron, B12, imbalanced thyroid, vitamin D, looking at sleep and stress are really important things to consider as well. And so now I just want to talk about gut health and mental health in the news. So the recent research and latest studies that have come up with respect to specifically gut health and mental health. So here we looked at PTSD, or post-traumatic stress disorder. And so the bacteria in your gut can actually hold clues as to whether or not you will develop PTSD after experiencing a traumatic event. So stress hormones can affect bacterial growth and compromise the integrity of the intestinal lining. This results in bacteria and toxins entering the bloodstream. This causes inflammation, which has been shown to play a role in several psychiatric disorders. This study basically compared the gut microbiomes of individuals with PTSD to that of people who experienced significant trauma as well, but didn't develop PTSD. So these were the trauma exposed controls. They actually found that in those who developed PTSD, they actually had a specific set of bacteria that weren't found in those who didn't develop PTSD. So that means that you can be exposed to a stressful traumatic event and not to develop PTSD versus someone who does, based on the type of bacteria you have in your gut, which is super, super interesting. Gut health in pregnancy. When you are pregnant, you are obviously growing a human, and so the gut bacteria that you have is actually really, really important. They found when pregnant mice were exposed to stress, it changed the makeup and the bacteria in both their guts, the placenta, as well as the intestinal tracts of their female offspring. And these changes lasted into adulthood. So the mice with stressed mothers actually struggled in tests that were looking at cognitive health, anxiety, and then their markers of inflammation actually increased in the placenta, the fetal brain, and the adult brain of the offspring, while a supportive protein decreased. So when the mom was stressed, it actually really impacted the offspring into adulthood. Probiotics in depression. Another study looked at the composition of the gut microbiome before and after mice were subjected to stress. With the loss of lactobacillus, that is a specific strain of probiotic, came the onset of depression symptoms. They found that feeding the mice lactobacillus with their food actually returned them to normal. So that's really, really interesting. Although it is in mice, it is really interesting that a specific strain has now been looked at with respect to depression. And that's about it. So if you have any questions with respect to anything gut health, mental health, let me know. You can find me on Instagram at Dr. Laura ND. You can find me on Facebook, Dr. Laura Pfeiffer, naturopathic doctor, and on my website, www.laurapfeiffer.com. www.thehealthcoach.com. You can also download your free guide to my top tips to help modify your gut. That is a free PDF guide. So make sure you head to the link that I have provided in order to download that. Thank you for listening.